Hello, and thank you for being a part of the Handwashing Thursday series. My name is Ron Klimmer, and I'm with the Global Handwashing Partnership, which is a public-private partnership providing leadership to advance handwashing with soap. Before we get going, just a couple of housekeeping notes here. Participants will be muted throughout the webinar, so please use the Q&A feature to ask any questions to the presenters. Also, the webinar will be recorded, and the recording and the slide deck will be available at the landing page for the Handwashing Handbook on the Global Handwashing Partnership website. We are dedicating this webinar series to the late Professor Val Curtis, who was such a great advocate and leader for handwashing. In 2001, she saw the potential of bringing business, science, and policy together to promote hygiene. Through her passion, charisma, and evidence-driven approach, she co-founded the Public-Private Partnership for Handwashing with Soap, which later became the Global Handwashing Partnership. Her creativity and advocacy efforts contributed to the establishment of Global Handwashing Day, and she was involved in the development of countless practical handwashing tools, including the previous version of the Handwashing Handbook. So at the Global Handwashing Partnership, we truly owe Val thanks for contribution to both the partnership and the Global Handwashing Day. But Val's leadership and impact has influenced the work of all hand hygiene actors and will continue to do so for years to come. The Handwashing Thursday series of webinars covers the different topics of the Handwashing Handbook, which was launched on October the 15th, Global Handwashing Day. The Handwashing Handbook serves as an all-in-one resource for handwashing programming. The Handwashing Handbook pulls from the many learnings and experiences of the partners of the Global Handwashing Partnership and aims to equip handwashing champions in government, civil society, private sector, and NGOs with the tools and resources to facilitate a significant scale-up of the practice of handwashing. Please visit the landing page for the Handwashing Handbook at the Global Handwashing Partnership website and download the handbook, view the related resources, such as the recordings of the previous webinars in the Handwashing Thursday series, and please do leave a message or question on the Handwashing Handbook forum. Today's webinar will focus on one specific today's webinar will focus on some specific items from the Handwashing Handbook, including context for handwashing, as well as integration of handwashing with related programming. On the screen, you can see the schedule for the other webinars in the series. And then we hope that you would join our final webinar in 2 weeks as we dive into addressing handwashing at a systems level. And please visit the landing page of the Handwashing Handbook, where you can download the handbook and view the recordings from the previous webinars. And eventually today's webinar, the slideshow and the recording will also be linked on the Handwashing Handbook landing page. Integration of handwashing starts with water, sanitation, and hygiene programming. I know that sounds like handwashing is automatically integrated, but we still find that meetings that are covering broad wash topics, which give little attention to handwashing, and unfortunately, we often find inadequate handwashing programming as part of WASH projects. But the full benefits of a WASH program cannot be realized without achieving improvements in handwashing practices. Another type of programming that cannot be completed without a focus on hand washing is infection prevention and control in healthcare facilities, where the potential for eliminating over half of healthcare associated infections can be accomplished through proper hand washing. And the list goes on. Programming such as nutrition, education, and early childhood development, which depend upon good hand hygiene to achieve optimal results for the target populations. Child health is one of the examples of related programming which requires a focus on hand washing to accomplish target improvements, including reductions in the two largest killers of children, pneumonia and diarrhea. Children who practice hand washing on a regular basis are 50% less likely to contract pneumonia. And hand washing at key moments can reduce diarrheal episodes by more than 40%. So hand washing is an essential weapon in preventing childhood mortality and morbidity. Another important child health issue is neglected tropical diseases. Improved hand washing among school children has demonstrated a reduction of almost 70% for soil-transmitted ailments. So good hand hygiene is needed to achieve a wide range of development goals, as poor hand hygiene contributes to diseases which rob families of health and financial resources, and the absence of adequate hand washing also contributes to malnutrition, school absenteeism, and inequality problems. So hand hygiene is a much larger issue than just accomplishing our goals of wash programs and hygiene requirements in healthcare facilities. So today's webinar will include presentations on addressing hand washing in conflict-affected settings, as well as integration with immunization, NTD, and child-focused programming. And now I am pleased to welcome my colleague, Erin Palomares, who will be serving as today's moderator.
Thanks, Ron. So first up, we have Tom Heath, a WASH Technical Advisor for Action Against Hunger, and his presentation will focus on hand washing in fragile and conflict-affected settings. Over to Tom.
My name is Tom Heath, and I work with Action Against Hunger as a WASH Technical Advisor. And I'm going to be speaking to you today about hand washing in fragile and conflict-affected settings and how that impacts the types of programming that we undertake. So, in settings where we've had an infectious disease outbreak, a natural disaster, an armed conflict, or a forced displacement, WASH systems are often damaged and health systems become overburdened or dysfunctional, which creates the environment which is ideal for the spread of pathogens. I like this quote, or I don't like this quote, is that during conflicts, children younger than 5 are 20 times more likely to die from diarrhea than from violence itself. Often during these crises, the principal cause of death or disease is from the displacement, from poor hygiene, from poor health practices. So we need to engage with how we as actors can support that. So if we look at, there's a lot of existing theory, good practice, case studies about how we can do hand washing, how we can promote hand washing, how we encourage it in more classic, stable settings. Can we just copy and paste this and use it in ways that we're already doing? And in short, no. And it's due to constraints. We have less capacity, principally less time, and issues of resources. In addition, people are affected by the crises themselves. So the determinants that are affecting their behavior are different. We know that we need to adapt the types of programs we do to the context and to the behavioral context, the behavioral determinants of that location. Now, because of this lack of time and resources, we're not able to always dig into that. They're not going to be the same. The components will be different. So we need to look at different approaches. Now, this is what is done typically in hand washing programs. It involves distribution of hygiene products and education about the benefits of hand washing. This is done again and again by a lot of different agencies. When you look at, okay, their suite of activities are during an emergency response, what's to do that water, the sanitation, and the hygiene, it's kits, and it is education. Now, I really like this quote. I think it's extremely powerful. And it's a point about this education about hand washing, and the need to move away from this and engage in more intelligent ways of talking and having two-way communication with the people that we're trying to work with. I can tell you that I had a good life. I was rich. I had cows, goats, and many farms. But everything changed when I was displaced, when I became an IDP. Now everything is bad. Everything I had was stolen. And today I am as you can see me. You cannot blame me if I don't always wash my hands. Give me back my previous life. See how my emotions and life would change. And there will be a high chance I will wash my hands with soap. We are sad every day, working hard every day and earning less. We're discriminated, really. It's a good thing that your organizations don't forget us, but you come and just talk. We know what we should do, but we don't have soap or water here, and we're living like animals. It's important to put the people back into the center when we're thinking about these programs. So what I wanted to do, laid out some of the sort of the context of the constraints, the challenges, actually talk about some of the things that are done and sort of the more positive examples. And recent evidence has highlighted that the access to conveniently located, desirable hand washing facilities with soap and water is likely to be the most effective way of changing behavior. Don't tell people to wash their hands. In Congo, we looked at IDP sort of knowledge of when you should wash your hands, and 99% of people were aware that you need to wash your hands. It's inbuilt. You don't need to tell people to wash their hands. You need to engage with them, to motivate them, to encourage them to wash their hands. And part of this, one of the most important features in the first phase, is ensuring that people have the ability to be able to do that. So to start with, I want to show you two products. This is the super towel, the blue towel, which was given as part of a kit, as well as soap in Nigeria. And it's a towel which is embedded with antibacterial chemical, or it's a process, and essentially allows people to wash their hands just with the towel. Through the process of washing their hands when the towel is wet, it is sort of a log4 reduction, so 99.99% of pathogens reduction. So it is as effective as soap, but it doesn't run out. So we're doing a pilot in Nigeria at the moment to see, whether people like this. And so far, it's been very, very positive. It's an alternative product which deals with the fact that people often hoard soap, sell soap, or use it or just run out because the kits aren't big enough. Another product which I liked is the surprise soap, which touches that, how can we do things without having to explain them during emergencies? And the surprise soaps were designed particularly for children. I think it's sort of a child-based approach, then motivating the adults to engage with sort of these toys inside, which encourages children to wash their hands. They're exploring using 3D printers. They looked at different types of toys that were all safe. And I think in the last study I saw, there was a very small number of sort of toy cheats, like people continue to wash their hands, and also adults seem to work really well. And the added cost was quite low, and it makes it fun, which for me is one of the most important components of how we engage with this. Then if we look at some of the approaches which are engaging not just with the hardware, but with some of the software components. So Oxfam have developed a package which is called Mum's Magic Hands. It was developed with Oxfam and Unilever. And it's a set of interactive behavioral change activities that are based on storytelling and emotional drivers. It's principally around affiliation, and trying to sort of tap into that aspect of nurture of a mother. These two drivers come out very strongly in a lot of different crises and have been proven to be effective. So Oxfam have on their website have a whole suite of activities for the early crisis, but also sort of later on with examples in different languages that can be adapted. And lastly, Washem, which is a project that I'm involved with, which is it's a process to help teams design hand washing programs based on the constraints of an emergency. So there's the website washem.info can give you further information about the tool, and it's a tool which enables you to collect rapid information from your populations. And then you put in context information, the results from the data you collected, and this goes into a software package which is sort of based on a whole series of like 2 years of research and different rules, etc. And it gives you adapted recommendations based on the context and determinants that you can use and would be appropriate in your situation based on your constraints and budgets. I guess the point is, working in emergencies has all sorts of challenges. Principally, I'd say the priorities and the number of things that have to happen at the same time with limited time. So finding ways to be able to motivate hand washing and improve health is extremely important, but something that is possible. Thanks.
Great. Thanks so much, Tom. I think you brought up some really great considerations and examples there. And I think it's important to integrate hand washing into crisis response efforts as well. Next up, we have Ms. Aisha Shaith. She's a senior brand manager for Unilever Lifebuoy and will be presenting on
Hi everyone. I'm going to talk to you about the partnership between Unilever Lifebuoy and Gavi, the Vaccine Alliance, which is an intersectoral cross-thematic partnership. Now, we came together in 2017, and the key objective was to drive demand generation on hand washing with soap and complete immunization. These are both cost-effective interventions impacting childhood illnesses. They have a common target population of children under 5, and we wanted to leverage our complementary understanding and experience on demand generation to address these. We kick-started this partnership in India because of the aligned government commitment towards both water sanitation, hygiene, and complete immunization. The project was divided into 3 phases, and we've completed the pilot phase and phase 2, and we'll be kick-starting phase 3 early next year. Our implementing partner is Dialogue Factory. They are an experiential marketing agency and work with a consortium of partners like Ogilvy and Mindshare, who have a deep understanding of both creative and media respectively. Now, when it comes to leveraging expertise of both the organization, Unilever Lifebuoy understands consumer insights, has years of experience in combining marketing and public health principles around hand hygiene habits, knowledge on efficient use of digital channels, and distribution capabilities that help reach at scale. Gavi has experience in supply chain and deployment capabilities around vaccines, expertise in impact measurement, and strong relationships with governments, which are really critical to buy-in right from the start of a program. While there was a common objective of coming together related to positive health outcomes, we had to address what was the common factor joining these two disparate behaviors at a behavioral level. Immunization takes place outside the home, while hand washing usually takes place indoors. Immunization is a fixed number of events, while hand washing is a routine habit related to activities. One is dependent on healthcare workers, while the other is more self driven. Therefore, we had to find something that not just brought them together, but would do so in an appealing way. When it comes to behavior change, we look at our target audience as consumers and not as beneficiaries to understand what would help improve demand generation. Therefore, finding the right consumer insight that could link these behaviors was critical. And this insight was that every parent wants their child to be successful. We know that infection prevention is crucial to the child's development, and that immunization and hand washing are important to infection prevention. These are steps that parents could take and be responsible for. We now had to find an aspirational way to package them together. We conducted further formative research to assess the insights and behaviors more deeply. Some of the key findings were that while people knew the importance of immunization, they lacked awareness around complete immunization. Hand washing was restricted to visibly dirty hands and was still a matter of convenience. Parents felt little sense of control over illnesses in their children's early years and the future of their child. And there was a struggle to understand the link between hygiene, infection, and child development. Conscious parenting is not something parents, especially in rural India, are thinking of. Shifting that locus of control by helping them with easy activities to do under parenting can help position their child for better development and success even before school. This gave rise to the program Safal Shuruat, which means successful beginnings. Of course, we were very mindful of how we communicated this, as we did not want to set any unrealistic expectations amongst the parents. The other behaviors that are promoted under successful beginnings is nutrition, enrichment activities for cognitive and motor development, interspousal communication, role of fathers, and these topics are also covered in the immunization card given to parents, but they've probably not been briefed about this previously. Therefore, the idea was providing them a more holistic package under successful parenting activities. Now, this slide gives you a snapshot of what were the multiple touch points that we've used to communicate the key messages. A key part of the program has been the facilitator duo or the health promoters, both male and female, to ensure that the male members are able to support and discuss topics with the fathers much more easily. Now, as part of the multi-channel approach, it includes in-person household visits, mobile reminders, and interaction with the existing government infrastructure. Therefore, there's continuous message reinforcement from all these different touchpoints. The in-home visits included viewing films of varied formats, incorporating different motivators to spark spontaneous discussion. Gamification has been used to demystify concepts and engage parents and kids, bringing to the forefront barriers around the behaviors and group problem solving. Mobile has been a very important part of the program. We wanted to leverage the vast penetration of mobile in rural India. Therefore, there have been a series of push reminders and group calls to constantly reinforce the messages between the household visits. But we are also assessing that in the true spirit of demand generation, are parents self-driven to dial into a mobile service and gain further information on these topics? We conducted concurrent monitoring on the pilot group that received intervention and saw improvements from baseline to the fifth monitoring visit. While there has been an overall improvement in hand washing with soap, some of the other key standouts were that there is presence of soap and water together compared to the baseline. The proportion of parents possessing an immunization card has gone up, which is a good proxy of understanding if immunization is being conducted. And hand washing with soap is being reported by the parents as one of the key activities under successful parenting. And so the state of Uttar Pradesh was recognized by the Ministry of Family Health and Welfare on this particular interventions, and this intervention was published as part of the good and replicable practices and innovation in public healthcare systems in India. While there have been successes around the partnership and great enthusiasm, multi-sectoral ownership is a challenge, not because the program is conducted by external health promoters, but because of the different topic areas. They fall under different ministries, and hand washing with soap does not specifically fall under any single ministry. Therefore, as part of phase 3, we want to build a stronger digital focus and make mobile services as central to behavior change as possible. Additionally, we want to reposition the package in an aspirational way for the health workers because they are the ones eventually responsible for deployment of multi-sectoral programs on the ground. With that, I complete this presentation. Thank you so much for your time.
Great, thanks so much, Aisha. And I know a couple of you had some issues with viewing the slides in the chat. We sincerely apologize that I think with the switch to the digital world, there's always going to be some technical hiccups. But just to let everyone know, the slides and the webinar recording will both be available on the Global Handwashing Partnership in the next couple of days. So feel free to access those slides then. Moving forward, we have Ms. Dorian Turjman, who is the head of operations for NALA, and she'll be discussing hand washing integration with NTD's programming. Over to you, Dorian.
Thank you, Erin. Hello, everyone. My name is Dorian, and I'm the head of operations at NALA. First of all, I would like to thank the Global Handwashing Partnership for having me here today. In this presentation, I will introduce NALA's work on the promotion of hand washing practices as part of neglected tropical diseases prevention and elimination programs in Ethiopia, and the different aspects of the behavioral element of hand washing. Neglected tropical diseases, in short, NTDs, are a group of diseases that are common in developing countries, specifically within rural communities and among poor populations, and they're referred to as diseases of poverty. They impact 1.5 billion people worldwide, and they are directly connected to poor hygiene practices and lack of adequate sanitation conditions. These are behavioral diseases which are related to certain hygienic behaviors, and in particular, hand washing and body hygiene. They're called neglected since until recently, they were not globally prioritized due to the fact that they are not prevalent in developed countries, even though in the long terms, repeated infections over time can pose many health risks. They can cause permanent damage and are at times even fatal. In the image on the right, you can see the prevalence of some of these diseases within the different districts in Ethiopia, which total 770. The two most prevalent diseases, soil-transmitted helminths and trachoma, are preventable with proper hygiene and enabling environment which allows regular hand washing. With the vision of a world free of curable diseases that perpetuate poverty in our minds, we strive to eradicate NTDs and other diseases of poverty, which are related to hygiene and sanitation, and we focus on the behavioral element through education. Our holistic intervention model addresses all elements of disease elimination, complementing mass drug administration with behavioral change health education, promotion of wash intervention in the community and school levels, and intense work on government policies related to disease prevention and wash prioritization. All of this is done by intense community engagement and ownership as part of our impact-driven approach and the importance of sustainability in mind. As I previously mentioned, NTDs are behavioral diseases, which are preventable with proper hygiene behaviors and particularly regular hand washing. The focus of our work is creating hygienic behavior change for hand washing, face washing, and latrine usage. To do so, we work at the ground level to uncover and understand the root causes for the hygienic practices that are common within the community and that are causing the high infection rates. In order to create a sustainable change, we operate interactive health education programs which motivate the target population for change by addressing the root causes directly and manufacturing an emotional connection through games, relatable images, and role play. These programs also encourage local community project, which addresses the need that arises from the community. These programs are practice-based and they aim for habit creation. For example, regular hand washing in set occasions like before and after meals, after using the latrines, and after playing outside. One of our flag programs is an early childhood education, which targets children at the ages of 0 to 9, since habit creation in these young ages have been proven to be significantly more successful. One of the major obstacles for regular hand washing is lack of access to water and sanitation facilities, and so behavioral change will not suffice on its own. This is why we also work on creating enabling environment. Although we are not a WASH organization, we do promote construction and maintenance of WASH facilities in schools and households in different levels, utilizing local and innovative, simply locally adapted and locally sourced solutions. In some projects, we collaborate with the local authorities and existing community structures to construct on constructions of facilities. For example, in South Ethiopia, where it rains about 9 months out of the year, we operate WASH programs in which we construct rain harvesting hand washing stations in schools and work on proper maintenance schemes with the local government in order to establish local ownership and ensure sustainability. In other projects, we focus on advocacy and awareness raising within communities and their leaders to emphasize the importance of an enabling environment for hand washing. Nala has been working in Ethiopia for many years now, and during the years, we've established collaborations with local authorities in the major regions of Ethiopia. Together, we work to promote proper hygiene practices and enabling environment in all levels. In 2016, following our proven successes in several districts, the federal government requested us to provide technical assistance to the National NTD Control Program. Since then, we have supported the government with the creation of the National Framework for WASH and NTD actors to work together on disease prevention. The Ethiopian government is a real pioneer in this aspect, and coordination mechanisms were created in all administrative levels. These mechanisms prioritize resources, create joint indicators across sectors for success, and supervise the implementation. Together, we have identified the district level as the most influential for creating changes on the ground. We have created a district level implementation toolkit for bringing the different sectors together: water, health, education, and finance, and have tested it in 99 districts throughout 2019. It is now adopted and is scaled to the rest of Ethiopia, and we can really see resources allocated for WASH for disease prevention. Since the COVID-19 outbreak, global and national attention has been given to personal hygiene and hand washing in particular. This poses an opportunity to improve sanitation conditions and access to water in both community and school levels. In Ethiopia, around 77% of schools have no access to water sources on premise, and 60% have no access to sanitation facilities at all. Due to the renewed attention to hand washing, we are given the opportunity to support the reopening of schools for the new school year. As the Ethiopian Ministry of Education mandated that water for hand washing be available as a prerequisite for reopening of schools, we are collaborating with the Gates Foundation on an intense and quick intervention, which aims to create an enabling environment for hand washing using a mobile wash clinic that will refurbish existing non-functional infrastructure. This will, of course, also promote the infection prevention of other diseases, including hygiene-related entities, and accelerate their elimination. Thank you.
Thanks so much, Dorian. Yeah, it's really great to see all of the multifaceted and integrated efforts that NALA is doing to really ensure behavior change. So last but not least, we have Peter Hines, a WASH program manager at World Vision, who will be presenting on behalf of the Clean Fed and Nurtured Coalition. Peter, over to you.
Great. Thanks, Erin, and thanks so much for the Global Handwashing Partnership for putting this great webinar series together. Well, good morning, good afternoon, good evening to everyone on the webinar. I have the pleasure of closing out the presentations, and then we'll have a good, robust time for questions. So do be getting your questions in your head and placing them in that Q&A chat. So yeah, as Erin said, I come from the Clean Fed and Nurtured Coalition, and so some of you may be aware of the Baby Wash Coalition or the Clean Fed and Nurtured Community of Practice. Those two groups joined in 2018, so now we're one unit, and we really focus on the nexus of 4 different sectors. That's WASH, maternal newborn child health, nutrition, and early childhood development. So I really like this quote on the screen. It comes from the charter of our group together. And I would just say, you know, we're looking at specifically those first 1,000 days, so the early years of a child. And I think hygiene and hand washing runs really strongly throughout that time period. And so it's, you know, really a strong focus of ours within the coalition. So we believe very strongly that while integration can be very challenging, we've heard from lots of people that it can be very challenging, it's definitely worth the effort for children to have the best outcomes possible. So as we think through different types of interventions, we've put this figure together to show examples of hygiene and just missed, often not prioritized interventions in these 4 sectors. So I know this is a lot of text on a slide, but some things just to highlight as we think about hand washing and hygiene. On that WASH, maternal newborn child health nexus up top, we think about cleaning hands of birth attendants for safe delivery in a healthcare facility as one major intervention we might consider. On that WASH nutrition nexus across the sides, clean hands before feeding a baby and preparing food. So thinking about food preparation, food hygiene is a key piece. And then on that WASH ECD nexus, specifically thinking about clean play spaces, clean toys, how do we make sure that kids have an environment that's stimulating to their brain, but the things they're interacting with and putting in their mouth, because all babies have mouthing behaviors, are clean. So the key is that no one sector can own integration on its own, which actually can be a negative, because if every sector thinks it's someone else's job to do integration or to do hand washing, then no one really owns it, right? And so we need to show sector examples where integration of hand washing and hygiene has been successful, therefore spurring action and ownership of all the 4 sectors towards hand washing and hygiene and integration. So one of the things the coalition did was we gathered a number of case studies from partner organizations within Clean Fed and Nurtured. This was a few years back in 2018, and we created something that we're calling an integration how-to for program implementers. So it literally goes through 10 common themes that we saw in all of the case studies that we collected that we thought were helpful or common threads that came out for integrated programming. And so I wanted to go through them today with all of you with a special eye towards hand washing and hygiene, because I think it might be helpful to garner ideas for us to think how we might move forward in a practical way. So the first point there is to start small. I think often if we go in and we propose something really big, so a really big hand washing component inside of a nutrition program, people say, wait, that hand washing is not a nutrition intervention. Why would we do that? And so by starting small, doing a pilot program, showing impact, that's how you can get buy-in and eventually scale up. Our second point here is around utilizing internal champions. And so especially in our World Vision work, but in all of the case studies we saw, often success of a program was due to one, maybe a handful of individuals who really got it, who really understood that in our case, for the children in those first 1,000 days to thrive, it wasn't about one sector or one vertical program. It was really about an integrated suite of interventions. And so therefore, those people being really passionate helped move the program forward. So if you're in a management role or you have people on your team who are really excited about integration and about hand washing, I would just urge you to let that passion run free. I think it'll really help integrated programming in the long term. The third point there is engage partnerships. And so often our individual organizations end up getting specialized and having particular focuses. So this organization is really good in behavior change. This organization is really good in WASH programming. This organization is a nutrition organization. And that can cause some barriers to integration because an individual organization does not have the sectoral expertise to feel confident to involve multiple different interventions. So we found that the programs that have been most successful have brought in partnerships either as consultants or just consulted by informal conversations with how would you do this. So please look around, see who else is in the area where you're implementing and think through how can we work together for the best integration. Number 4 here is strengthening the evidence base. And so what's really frustrating is, especially for hand washing, as Ron was saying in the beginning, we have really good evidence for the effectiveness of hand washing. However, there's not always tons of great evidence for this plus this together is better than those two interventions are apart. What we'd really like to see is what I've heard other organizations talk about, this 1 + 1 = 3, that integrating together has a larger impact than each individual intervention has together. We'd love to see, hand washing and insert your favorite intervention there having a multiplicative effect. There's some of that, but we really need more evidence to be able to convince funders that this is a good idea. So as you have small programming, if you're starting small, please, as often as you can, include a bit of research in there so that we can continue to grow and forward as integrated champions. 5th there is leveraging government frameworks. So more and more there are government priorities. They're coming out with nutrition frameworks on the nutrition side or nurturing care frameworks on the ECD side. So if you have a program that is pretty WASH heavy, but has some ECD pieces on it, and the government you're working with has a really strong nurturing care framework, as you're talking with the government, lead with the ECD piece, right? Integrated programmings are nice because they have multiple different entry points that someone can get interested in to learn about the program. And so be strategic with what you lead with, depending on what the government or stakeholders' priorities are. Number 6 is around explaining the interlinkages between different sectors. And so again, this goes back to not having sectoral expertise sometimes, that a WASH expert knows a lot about hand washing, but doesn't know why that would be necessary in a nutrition space, right? And so it's really important to make those key linkages of why these sectors make sense together, and especially make those to community members, because there are actual people that we're trying to reach. And if they understand why these projects go together and why these interventions make sense together, then I think we'll be much more successful from a behavior change lens as well. 7 is frame integration around the child, be child-centric. And so especially for us at Clean Fed and Nurtured, as we focus on those first 1,000 days in the early years, that's a no-brainer for us. But often, if you can say, a child does not have one need, right? A child's needs in those early years are very multifaceted, and therefore we need to bring in multiple sectors. We'll have a better sense of framing the reason for why we need multiple interventions together in one program, and always bring in hand washing for that piece. Number 8 is encouraging meeting together. And so this sounds really simple, but often I've worked in a program and I've said to my WASH folks, since I'm a WASH program manager, go talk to the health colleagues as you're working in healthcare facilities, make sure that you're aligned. And they say, yeah, but then never actually do that in a meaningful way. So have sectors come together, meet together, plan together, do monitoring trips together. Once COVID is done and in the rearview mirror, hopefully we'll be able to do a lot more of that together. And the last 2 here, promote cross-cutting themes. I think hand washing especially can really be a cross-cutting theme for a larger program. If you frame it in that context, that can be really helpful for integration. And last is committing to capacity building. We've seen that, again, for WASH implementers, if you train them more on the impacts of nutrition and how WASH connects to nutrition, that's a way to build their technical skill as well, make them feel like they can contribute in nutrition meetings more, and then you actually end up keeping staff on longer because the organization is building up expertise of individuals and building their own staff. So those are our 10 steps here that we've put together from looking at case studies. Just one example I wanted to share with you before I ended today was an example that World Vision did in Uganda. We actually partnered with the Manoff group to do trials of improved practices. And so we were doing this in Uganda, Kenya, Somalia, but the Uganda team really has taken it and moved it forward. And so we brainstormed things around infant hand washing, so washing hands of babies clearly, infant feces disposal, as well as what would a clean play space look like in Uganda. And so enumerators would go to a mother's household, give them some information around these 3 topic areas and say, does any of this stick out to you? Do you want to try any particular interventions that might help impact any of these pathways? And so we actually found the ones that were doing infant hand washing were really popular. They were child-centric, thinking back to that list, right? It was looking at internal champions for Uganda because we had a couple folks that were really excited about it. And because we started small, this was just, 100 households or so, we were able to do it in a small way and generate a bit of evidence through this TIPS process for how infant hand washing really grew mothers and babies closer together. It made the bond closer and had those ECD impacts as well that we were hoping for. So the Uganda team put together a flip chart and began to put all of this stuff that they had learned in the TIPS process into their larger IEC materials, going door to door, talking to mothers. So in the prenatal care visits, they included messaging around infant feces disposal as well as hand washing, and the connections really between ECD, hygiene, and nutrition were all of those key pieces. And so thanks to the small pilot project, we were able to grow it overall in Uganda. And I really think our staff, going back to that capacity building point, now 2 years on, feel a lot stronger about being able to talk intelligently and have a contribution about these integrated sectors and why it's important. And so I don't have to talk to them at all because they're the champions on the ground pushing this work forward. So that's what I wanted to leave you with. I think these 10 steps hopefully are a bit helpful as you think about, well, how do we move forward with integration, and specifically around hand washing. I think because the evidence is so strong, hopefully it's an easy in to start on this integration pathway that we can all move forward together. So thanks very much.
Thanks so much, Peter. Yeah, I think you provided a great example from Uganda, and I think it's a great way to wrap up these presentations with those practical steps as well. So we'll now move into a moderated panel discussion, and I'd like to invite back all of the presenters to join me with this. And while we do have some prepared questions for our presenters, please feel free to use the Q&A feature to ask specific questions as well, and we'll get to those. If for some reason we can't get to your question during this webinar, we will compile all unanswered questions and ensure they're answered in the follow-up materials. So moving on to the panel, I'd like to first pose a couple of questions to the group, and with hopes to hear some of your insights and dive a little bit deeper into both the benefits and the challenges of hand washing integration. And I think each of you in your own way showcase different examples to integrate hand washing with related issues or within a given context. Tom's case. And those really provide successful case studies for us as we think through ways to better integrate hand washing into our own work. But what are some of the challenges of integrating hand washing with other programs, and how do you, or really how have you overcome those challenges? And perhaps Durian, would you like to start off?
Yes, sure. So one of the major challenges that we can see specifically in rural areas where the endemicity of diseases is very high, there is a problem with infrastructure and access to water, even in terms of local access, in terms of local infrastructures or access to municipal water systems, that we see that even if there is a connection, many times it doesn't function, it doesn't work very well. And you have days of children in schools having no access to water after using the latrines before eating their lunch, which obviously increases the disease disease prevalence and the infection rates. And so this is, for me, one of the major issues. And looking at the infrastructure, every time we face this issue of looking for innovative and very on-the-go solutions to try to figure out, okay, so sometimes it's like working in disaster areas where you have no access to anything, and you need to think very creatively on how to create this access. And one example is the one that I provided in the presentation, is when we're working in areas where it rains many months out of the year, having rain harvesting systems or some sort of this type of solutions to have access to water at all time as much as possible, even when the local infrastructure just doesn't work. One other solution that we've had was with hand washing stations that were operated with the foot for COVID-19, because we wanted to decrease the spread of the disease. So we had to come up with a solution that does not spread the disease within the community. So foot operated stations. So it's all the time adapting to the local context and finding these creative solutions for that.
Yeah, definitely, Durian. Any other thoughts?
Yeah, I think just to add to that, one of the other challenges is measurements on KPIs, especially when you're sort of linking different topics together. Sometimes they, apart from sort of thinking about which topic should have how much weightage, there's also sort of concern around what should be the right KPIs measured. So sometimes you have a nutrition partnership with a hand washing component, and there are certain KPIs which might be unrealistic to measure and puts a lot of stress on the intervention that's being delivered. So I think the problem solving there is a lot of conversation with, of course, your research agency and the partners that you're working with and the funders to kind of ensure that there is a value to bringing hand washing to these sort of multi-sectoral partnerships. But I think the measurement around hand washing also needs to be realistic. To just give an example, for example, if it's a community-based nutrition partnership, but they believe that integration of hand washing at a school level is extremely important, we need to ensure that the KPIs that we are measuring at a household level are relevant to the programming given at school. Otherwise, of course, there's a big mismatch, and unrealistic expectations should not be sort of set forth, and therefore clarity and complete alignment with the government, with your funders, with the multiple partners on what will sort of each intervention within the multi-sectoral partnership deliver is extremely critical to the success and sort of the eventual uptake of the partnership by the government as well.
Yeah, no, that's definitely a great point. Tom, I want to bring it over to you. Go ahead, Peter, if you'd like to join in.
I was going to add really quickly that I think that monitoring piece is really important, and what can we actually monitor is helpful. I think the extension of that to the beginning of the program is often there's some jockeying at the beginning of the program for what should we include and what should we not include. And what we hear a lot is around program creep, and that these other interventions, while connected, are not core to the outcomes we're looking at. And therefore, if you're looking for community health workers or an individual person to have to talk about 17 messages to the household, that's too many for them to deal with. And so that's one of the key barriers to integrating hand washing or other messages from the beginning. And so I think having that clear line to what is the outcome of the program and being able to monitor it as part of the entire program and as an essential piece of the program is really important, to be able to get those hand washing pieces in from the beginning.
Yeah, definitely 100% agree. And I think that that's definitely what we've seen in some of the previous webinars and some of our previous discussions as well in this series. Tom, I want to bring it to you as well, because I know in an emergency setting, we often have to respond quickly. And so that in itself can be a challenge. How can someone effectively design a hand washing program in a conflict affected setting? And what are some key tools and resources that they can use?
Okay, yeah. Just on the monitoring point, I just want to carry on with that, and then I'll come back to that. It's within ACF on the monitoring, we're increasingly using the JMP, the Joint Monitoring Program, sort of standard for hand washing in terms of, is there presence of water, ash, is there presence of water or a hand washing device, to define our monitoring. And it's something that we're using increasingly, just recognizing the challenges of actually measuring hand washing. And we've just started our first experiment, actually looking at household observation. So having someone present for sort of 3 hours in a household to explore, what actually are the habits and routines of people. And I'm intrigued to see, is that something that we can do, especially linked to, when we're looking at a suite of different behaviors. I think exploring more using household observation, not so much in emergencies, although we're doing this in Nigeria during an emergency, is something that we can consider. In terms of the, designing interventions during emergencies, I picked up on some of these points during my presentation. I think a key one is, moving away from education and focusing more on provision of enabling people with the tools that they need to actually be able to engage with it, and then recognizing that you can create sort of colorful, creative, fun campaigns, and you can make the time for this. In emergencies, I think the challenge that we have particularly is time and bandwidth. So when you're designing, it's like, okay, teams aren't generally ready to take on new approaches. So it's how can you nudge them to engage in something that they've not done before, or something that's similar to a CAP survey, or the approaches they're already doing. What are the small adaptations that we can undertake for, doing small, maybe starting with the infrastructure, but also looking at some of the software components, and looking at, I mentioned Washem and Mum's Magic Hands. They're focusing on being a better mother and working with teams, promoting them. How would you encourage your grandmother or your sister to wash your hands, and humanizing people? If we talk in terms of integration, just one last point is for the wash cluster and for the sort of wash sectors involved in integration. One of the things we see in disease outbreaks is particularly this challenge of, with hand washing, when you have something like Ebola or even COVID, it's when it's between the wash cluster and the health cluster, and the coordination between these two bodies, and how do you bring together so many different ministries and the different individuals and link them up. And that dialoguing is often a challenge, because people become very sort of siloed in their programming.
Yeah, no, I definitely agree that it's important that we start to de-silo, and I think that you brought up a great point in terms of linking the different ministries. Does anyone have any additional thoughts on that?
I was just going to say to the Mum's Magic Hand example, that clearly has the wash and health piece too, but my brain sparked as well that ECD component of what is the nurturing care from mother to child in that program. And certainly we can't put an ECD program around a hand washing program. We can't, that might be too big of a hurdle, but having ECD experts take a quick look at that or the program to say, if you do these one or two small things, you're really involving nurturing care, and that I think is really important. And so even if it's not, you know, trying to do everything within ECD into that piece, how do we get experts to look at it and mention small tweaks that might have a big impact on programming on the backside, I think is really key for that integration piece as well.
Yeah, definitely. Any other thoughts?
Just the last one, sorry. A nice example we have from Nigeria that's really easy is just looking at the, you know, take what is the beneficiary experience of this program? Okay, so we have a nutrition program where they're going to the health facility every month and they're receiving cash. So this is the moment we're going to link in our our hand washing promotion. They're already doing health, they're doing hygiene. It's like, what's their timeline of this experience? How can we fit into what we're already doing? I think that's probably actually one of the best ways to really look at integration.
Yeah, definitely. Yeah, and I mean, I think that you all, you know, you've all touched on this a bit, and so I want to flip this conversation around too. Why is integration so important? Why don't we just implement separate programs for hand washing and these different issues, whether that's health, education, nutrition, or so on? You know, what is the value add of integrating hand washing with these other efforts?
Yeah, so I think that in terms of cost effectiveness, although we don't have specific numbers and evaluations of that, but it is obvious that once you integrate hand washing programs within existing programs with efforts that have already been made for whether it's NTD elimination or malnutrition or other programs, there is a cost effectiveness element, and also it's not 1 + 1 = 2, it's 1 + 1 = 3, because then you have a much more intense intervention that is more holistic. It brings all sectors together, and the efforts actually more than multiply. We're talking about resources, manpower, knowledge, you know, sharing knowledge, sharing expertise in different sectors. And one of the examples I can give from our work with Unilever's LifeBuoy actually program is in North Ethiopia, where we have a program that is aimed for the decrease of malnutrition through the decrease of diseases with hand and face washing focus in schools. And this is a great you know, example for integration that brings a lot of sectors together and touches on a lot of different elements of child's health. So yeah.
Isha, would you like to add on to that?
Yeah, sure. So I think just building on the point of manpower, I think at the end of the day, for all multi-sectoral partnerships, we need to also think of the last mile healthcare worker. I think in many countries, systems might be different. They might be sort of salaried by the government or a lot of healthcare volunteers or funded by a project. But for them, I think they eventually become overstretched and burdened. And so while we're thinking of also creating audience-centric programs so they don't have a message overload, we also need to think about the ease with which these healthcare workers can deploy a more holistic package. Because I think it tends to happen that while there's sort of, you know, at a higher level, there's alignment in terms of ministries coming together, seeing the value of intersectoral partnerships, we're really reliant on the last mile worker to be able to deploy them on the ground. And I think, therefore, they are equally important in terms of how we are training them. And I think multiple projects coming on board and training these workers on different thematic areas or even cross-thematic areas becomes an information and a work overload them, you know, for them as well. So I think we need to think about the importance of convergence, not just from sort of the target audience or the consumer angle, but also from the sort of manpower angle and how they're able to efficiently deploy intersectoral partnerships in a well-packaged way too.
Yeah, no, definitely. Yeah, and I mean, I think Tom and Peter, you know, as wash experts as well, what are the benefits of integrating hand washing into these broader wash programs? Because I think that that's often a challenge as well.
Yeah, I think for hand washing, more and more of us are looking at how do we have more touch base points for hand washing, because I think with the need for stronger behavior change, it's not just a one point in time interaction and then all of a sudden people wash their hands. We see that in the US too, where I'm based. And so just doing a triggering event for CLTS and saying you need to wash your hands is not enough. From Tom's example, in emergency settings, people say, yeah, we know we need to wash our hands, but the surrounding environment is not there for us to actually do it, right? And so I think we need to think more holistically about in wash, what are our major touch points? Maybe with sanitation marketing, there's continual reminders for hand washing, right? As people go and they interact with different types of products. I think building that supply chain and products is also a really important piece to hand washing as you pair that behavior change message with the actual infrastructural piece that's so important as well. Tippy taps are the lowest barrier to entry, but do they last long term and are they sustainable? I think most of us would say probably not. So what is the higher level of service as we think through JMP indicators that people are actually practicing behavior change? So I honestly, Aaron, don't know that we have a concrete answer of this is the way you need to do it in wash. I think we're still figuring it out and working on it, but it's nice to see that more and more organizations are thinking through those more frequent touch points in order to do it.
Yeah, definitely. Yeah, it's a never-ending iterative cycle. So yes, certainly we're always learning.
And I think from COVID, hand washing has evidently, come up the agenda. I imagine that's been discussed in some of the other Thursday sessions. It's so much more of a priority, and we're looking at ways we can, step up on that. And I think with wash, one of the things we need to look at is particularly thinking of the exit strategy, which I guess links back to Peter's point about the different, how many touch points you have, but then how do we sustain those facilities? And the nature of having those discussions hopefully should encourage people to make the tweaks, to think about how you're designing it, how you're using it, so that it can sort of, by doing that, hopefully you will engage with people's experience of using the experience and the motivation that's behind it. We had a project in Madagascar that was doing social marketing and was really pushing a new product, sort of like a jerry can on a stand. It was fairly simple, and we had a very big promotion campaign, like linking in with local artists. We had they made a video involving, we contracted local artists to kind of create something. There was a big stage, there was a big show, and the team worked really hard because it was social marketing and it wasn't hygiene promotion. So they were creative and they thought outside the box. And we ended up with, in fact, a massive change in the community with lots of people replicating the product because they were trying to push for people to buy this. They were thinking differently, and when we sort of looked at the studies afterwards, we could see that the community had replicated. Not that many people had purchased, but that wasn't really the objective. And I think being willing to be more creative with your hygiene promotions and giving the teams the capacity to have space. Just jumping on around the tippy taps, we had, as part of Washing, we did some sort of deep dive looking at why people wash their hands and different determinants. And we had some discussions around, that quote was from Congo. And in Goma, so some very poor IDPs with very basic facilities. And we were talking about tippy taps, and they were saying tippy taps are for poor people. And it's like, it's just there is a place for them, but I think thinking more about this service level and engaging more than just a tippy tap is important. I mean, they have their place, but I don't know if they always meet people's expectations and desires.
Yeah, no, I think that's a great point. And I think that also brings up, kind of links to some of the audience questions that we've seen here. I think this first one is a great one to start off with, because it's certainly something that we're thinking about at the Global Hand Washing Partnership, and curious to hear from this group as well. And Tom, you mentioned a little bit of it, but how can we build on the focus around hand hygiene during COVID-19 to ensure that hygiene has a place in related programming going forward? And I know that there's been a little bit of that discussion already, but how do we sustain these efforts?
I think that, first of all, something happened during this pandemic that made people really, because of the lack of knowledge in the beginning of the pandemic, people were frantically washing their hands and trying to keep their hygiene all over the world. And I feel like that brought us a few steps further in terms of habit creation, because once, few months people frantically wash their hands all the time, it kind of sank into the consciousness of washing hands in order to keep yourself safe from diseases, in COVID specifically, but in general as well. The example of what the Ministry of Education has done in Ethiopia, mandating that only schools with access to water will be allowed to reopen for the school year, made all authorities, local authorities and schools and school management think about how we can make this as something that is fixed, access to water at all times, because we want to stay open. Children need their education. If we close the school, children can't get education. And this is something that is extremely, in the mindset, is very important with the communities in Ethiopia specifically, but throughout the world, and making this connection between hygiene and hand washing in particular to getting education and getting work, being allowed into workplace. That made a major kind of change in terms of how hand washing is viewed. So I think kind of building on that in terms of future programming, on connecting it to education, connecting it to basically just the livelihood of people, because they know they need to wash their hands, but now something different has happened and they're taking this differently. So whether it's also in terms of resources, everyone wants to help. Everyone wants to create a change and impact with this COVID pandemic, and kind of riding on that, making sure that the resources go to sustainable solutions for hand washing in either IDP, concentrations, or refugee camps and schools, and everywhere that we see, in different levels, everywhere that we see there is a need, making sure that the resources go to the right place and for sustainable solutions.
Yeah, no, thanks, Darian, for that.
I think another thing that COVID has done is it has brought forward again the conversation around wash away from homes, especially around hand washing. And so I think often we talk about school wash programs and the need for children to learn about hygiene and hand washing and bring that message home to their parents. I think we haven't explored as much the idea of a healthcare facility being the place for sanitation and health, and that if people are visiting the healthcare facility and seeing an ideal situation for protection of health, they might bring that back to their household as well. So a lot of programs in the COVID era has really pushed hand washing facilities at healthcare facilities. And I think that could be something we take as well. The flip side of that as well is hand washing facilities in marketplaces or bus stops or common areas, which has not been something we've seen, at least in large conversations outside of this COVID pandemic. And so I think being able to keep that conversation going and saying, having hand washing be more accessible in more places, and therefore reminds people to wash their hands more often, is something that we can hopefully continue to write into grant proposals and into programming to keep that going after COVID.
Yeah, definitely. Yeah, that public settings piece is extremely important as well. Aisha?
Yeah, and I think just to add to that, as we think through, how do we keep sort of the hygiene component sustainable? I think another thing is tracking consumer insights. And what we've already been seeing in a lot of countries is, as the risk perception decreases, so is the hand hygiene habits decreasing. So ensuring that we sort of build that path, saying that while, yes, this pandemic has done sort of the market development for people who never use soap have probably started using soap, there will be a dip. And how do we sort of use that fact and use the valid data points to build a case for saying, therefore, to prevent something else like this, how do we have that sustainable funding integrated into multi-sectoral partnerships to support hygiene?
Yeah, yeah, no, definitely. Yeah, I think that that's something that we've seen previously. Just as the risk perception goes down, so do hand washing rates. So yeah, I think it's definitely a question in terms of how we move forward. Tom, did you want to jump in as well?
Yeah, just 2 points, but one building on that. I think, look, like the example of Ebola, there were like the Oxfam hand washing bucket, the plastic bucket with a tap everywhere, and there was, you know, a really high level of coverage, and there was a big usage of fear as a driver. And as soon as Ebola started calming down, people stopped washing their hands. So I think we need to be careful with how we use fear in motivating people, because it often stops. People want to forget that. They want to go back to washing hands. They want to engage. And if hand washing is associated too much with COVID, I think there's a risk that, well, people want to forget it. So it's how do we make it part of habits and being a good mother and other components in the campaigns. That's one point. And the second is just, you know, exactly, if we're putting these stations in the market, thinking who's going to be filling this in 6 months, because I think that's often quite difficult. So from the outreach, okay, who's going to be engaged with this is questions we need to make sure we're engaging with and thinking about.
Yeah, definitely. Yeah, and I mean, I think it's extremely important to think of, you know, the behavioral determinants for hand washing as we think through our programming moving forward as well, which, you know, I think links back to some of the previous webinars of this series. So yeah, so really great discussion there. Any other thoughts in terms of how we can move forward? So moving into some other questions then, you know, Peter, I was curious because the Clean Fed and Nurtured Coalition brings together, you know, these 4 different sectors. And I think it's a really great example of how, you know, a coordinated mechanism could, you know, bring different actors together. But why is it important to have this coordinated focus? And can you talk a little bit more about the coalition and how it works?
Yeah, I think as implementers, we often think in a very vertical fashion of this is my sector, this is my program. That's not how people interact with our programming. And so especially with kids in the first 1,000 days, they don't think along sectoral lines. Their needs are very multifaceted that span WASH and nutrition and ECD, which is all the things that we're thinking through. And so key interventions like hand washing really need to be advocated to be included in all of those sectors, which allows for a foot in the door, right? If you can get hand washing into a nutrition program, that allows for a larger conversation of what about clean play spaces for children or hygienic toys and mouthing, and then does that connect to ECD, right? And you might not get everything in that programming, but it allows for additional conversation. And so we at Clean Fed and Nurtured have been trying to elevate great examples of integration. We're really just a coalition of the willing folks that are trying to share best practices and things. And so we blast out key practices every 6 to 8 weeks or so in a newsletter. And so certainly something that we'd love you all to stay engaged with and send us your good examples. We always are looking, you know, I don't think there's tons of examples out there of really great holistic integrated programs, at least on a large scale. I think to one of the comments that came in, starting small is really important. I agree. I think the more we can showcase those small programs and showcase why they were impactful, the larger we'll get down the road to being able to have these large integrated programs. So please do send us your small successes so we can share them and champion them with others who are interested in integration.
Yeah, definitely. Yeah, I mean, speaking of showcasing some of those small successes as well, Dorian, I remember in a conversation that we had last week, you know, could you just discuss some of the other examples of NALA's integrated programming and how you've worked with the holistic approach there?
Yeah, sure. So I've already gave the example of working on with nutrition programming, but in terms of focusing on disease prevention, our programs usually provide a kind of a package for a few diseases, an intervention package for a few diseases at a time, and not just focusing on one disease, because a lot of these NTDs have this same mechanism of prevention in terms of behavior and in terms of how to keep personal hygiene. Some of them don't, some of them are more related to mosquitoes, for example, but those who are related to hygiene, we always try to kind of package them together. And if we are doing an intervention that focuses on trachoma, we will provide also messaging and address also schistosomiasis and soil transmitted helminths. And so we don't just, if we already put in the resources and efforts, we might as well, you know, try to as much impact as we can with the integrated programming. So all of our programs are integrated into all of the diseases that are related to hygiene. That this is one example that I think it works very well from the results in the field. And you know, as I said, our successes were recognized by the government as something that is scalable and has a large impact.
Yeah, that's really great to hear. Yeah, so unfortunately we are closing in on the webinar, but perhaps to end this discussion, I'd like to ask each speaker to provide one key takeaway or message that you'd like the participants to walk away with today. And maybe we could just go in order of the presentation. So Tom?
Don't educate people to wash their hands.
Yeah, thanks, Tom. Aisha? Oh, you're on mute.
Yeah, I think it's important to start small in terms of a pilot, but also to test it in terms of applying the principles of scale to ensure that the government can pick it up at the same level and with cost efficiency.
Yeah, definitely. Dorian?
Yeah, so I think my main takeaway is the work with the community and local structures that already exist in the intervention areas, because this is how you make sure that the program are sustainable, are most impactful, and you know that you can have a handover, like Ish said, a handover to the government, but also in terms of acceptability by the community, and that you actually touch the needs and the gaps, and not just what you think are the needs and the gaps, but the actual ones that come up from the community.
Yeah, definitely. And last but not least, Peter?
Yeah, I would say please share your successes and your failures around integration, because a lot of people are looking for what has worked and what hasn't. And please include research even in a small way as much as possible. That 1 + 1 = 3 is really what's elusive and what we're trying to prove. And so the more hits we can take at that to prove that integration is important, the better off we'll all be in including hand washing into our programming.
Yeah, definitely. Yeah, thanks for that. And with that being said, I'd like to thank all of our speakers for providing their expertise and experience today. You know, I think this webinar was particularly important as we think through the potential impacts of hand washing when it is integrated with some of these related programs. You know, I think as we heard from our speakers, hand washing does have many cross-cutting effects in many different contexts. And so it's important to understand how hand washing practice can be optimized, and really thinking through the value add and benefits of integrating hand washing with other programs. That being said, it's also important to identify hand hygiene priorities based on your context and your audience, and using a holistic approach to drive behavior change and ultimately habit formation. So before we end the webinar, I want to remind everyone that this is part of an ongoing Hand Washing Thursday series. The schedule for the series is listed in the link used to register for this webinar. And our next webinar will also be the last webinar of the series, and it will focus on addressing hand washing at a systems level, so stay tuned for that. And again, I'd like to thank all of the speakers, and thank you to everyone for participating. Follow-up materials for the webinar will be available in the coming days on the GHP website. Thank you all.